sluggish.
Point is to review the situation. Next is observe the customer's reaction, like if the customer really get upset. Okay. So what do you think, Willow? Willow?
Yes. Sorry.
What do you think about the point?
This is Melu. She was diagnosed with PTSD. The starting point is after she experienced the car accident, and since then, she didn't even want to go to sleep. The nightmares were so bad, she didn't want to remember it, but there it was. The smells, the sounds, it was real. The traumatic event affected her life. She had difficulty in concentrating, feeling irritable, always being angry and aggressive.
So, what do we mean by PTSD? After witnessing a surprising, unpleasant or dangerous event, some people may develop post-traumatic stress disorder, PTSD. It's normal to be scared during and after a terrible event. Fear is natural aspect of our body's fight or flight response, which help us avoid or respond to danger. After a traumatic event, people may have a variety of reactions, with the majority of them improving over time. Those who continue to have symptoms may be diagnosed with PTSD. The risk factors that may increase the likelihood of developing PTSD include exposure to dangerous events or traumas, getting hurt or seeing people hurt or killed, childhood trauma, having a personal history or family history of mental illness. The symptom of PTSD can be classified by re-experiencing symptoms like flashback.
Symptoms of PTSD can be grouped into 4 types. The first symptom, experiencing flashbacks, which involve reliving the horrific incident while also feeling bodily symptoms like a beating heart or sweating. Moreover, there are symptoms known as avoidance, which include avoiding thoughts or sensations associated with the traumatic incident, as well as avoiding locations, events, or things that serves as reminders to the experience. Next, there are also arousal and reactivity symptoms, which include having trouble concentrating, going to sleep, or staying asleep, as well as feeling tense, on alert, or on edge. Finally, there are cognitive and mood symptoms, which include difficulties recalling important details of the traumatic incident, loss of interest in previous activities, having unpleasant thoughts, and having ongoing negative feelings such as fear, anger, guilt, or shame. To be diagnosed with PTSD, an adult must have all the following symptoms for at least 1 month. Luckily, post-traumatic stress disorder can be treated by psychotherapy and also medications. So in a nutshell, Melu can take note that she can get better with treatment and medications. However, it may take some time to be fully cured. If you have been diagnosed with PTSD, things that you can do to help yourself. First, talk with your healthcare provider about treatment options and follow your treatment plan. Second, engage in exercises, mindfulness, or other activities that help reduce stress. Third, try to maintain routines for meals and sleep. Fourth, set realistic goals and do what you can as you are able. Moreover, spend time with trusted friends or relatives and tell them about things that may trigger your symptoms. And lastly, avoid the use of alcohols and drugs.